Asterisk, did you know that walking pneumonia cases in young children have skyrocketed by over 40% this year? Yeah, that's right. If you thought pneumonia only hits adults, think again. Introduction. So, what exactly is walking pneumonia? It's a milder form of pneumonia, but it still packs a punch. It's especially affecting our little ones this year, and today we're diving into why that's happening and what we need to keep an eye out for. Presentation of problem/challenge now. Let's talk symptoms. Walking pneumonia often starts with a persistent cough that just won't quit. Kids might complain of chest pain, fatigue, or even a low-grade fever. The tricky part? These symptoms can easily be mistaken for a common cold or allergies, making it hard for parents to recognize that something more serious is going on. A lot of parents might shrug it off thinking, "Oh, it's just a cold." But here's the kicker. If not addressed, it can lead to serious complications. The challenge is that kids, especially younger ones, can't always articulate what they're feeling, leaving parents in the dark. The last thing you want is to see your child struggling to breathe because the signs were missed. Exploration/development. So, what's causing this increase in cases? Experts point to a few key factors. First off, the changing seasons and fluctuating temperatures can contribute to respiratory infections. Then, there's the whole back-to-school scenario, where kids are back in close quarters, sharing germs like it's a game. Environmental factors like pollution and allergens can also play a role, making kids more susceptible to respiratory issues. Experts recommend keeping an eye on the air quality and limits on outdoor play during high-pollution days. Prevention is key here. Practicing good hygiene, like regular hand washing and staying up to date on vaccinations, can help ward off infections. If you notice your child showing symptoms, don't hesitate to consult with a healthcare provider for advice on testing and treatment options. Climax/key moment. Let me share a quick story that really highlights the seriousness of walking pneumonia. A friend of mine has a 7-year-old who started with what seemed like a harmless cough. Days went by and the cough worsened, leading to severe fatigue and difficulty breathing. They rushed him to the hospital, where doctors diagnosed him with walking pneumonia. Thankfully, he received treatment in time, but it was a scary experience for everyone involved. This emphasizes how crucial it is for parents to be vigilant and act quickly. It's not just a cough. It could be something more serious. Early intervention can be the difference between a quick recovery and a hospital stay. Conclusion/summary. So, to wrap it all up, walking pneumonia is on the rise, especially in kids, and it's a serious condition that shouldn't be taken lightly. We've talked about the symptoms, the reasons behind the increase, and the importance of early intervention. Being informed is the first step in protecting our children's health. Call to action, CTA. Now, I want to hear from you. Have you or someone you know dealt with walking pneumonia? Share your stories or questions in the comments below. And don't forget to subscribe for more health-related content. Together, we can keep our kids safe and healthy. Mycoplasma pneumoniae cases are 14 times higher than last year. Viral angle. Lead with this shocking statistic in bold, visual form at the beginning of the video. Use infographics or animated charts showing the steep increase to capture attention immediately. Viewers are drawn to surprising or alarming figures that affect them personally. What we have all been able to ascertain is that there is no novel pathogen, CDC Director Dr. Mandy Cohen said. This is all related to upticks of known viruses and bacteria in their pediatric population. A specific concern arises from the spike in cases of Mycoplasma pneumoniae, a common cause of walking pneumonia. While common, with approximately 2 million cases annually in the U.S., infections tend to peak every 3 to 7 years. The increase in respiratory illnesses following the relaxation of COVID-19 measures is a global trend, notably observed in the U.S. last year, experiencing a tripledemic of COVID-19, flu, and RSV cases. In November of 2022, the U.S. had the highest number of people hospitalized with the flu since that time of year, in 2010. This is China's first full winter season since it lifted its COVID-19 restrictions last December. Children there are especially vulnerable because of the length and intensity of lockdowns, also known as China's zero-COVID policy.